If you're over 55, you've been told the same thing over and over. Go for a walk. Walking is the best exercise for seniors. But today, you're going to hear something different. Something backed by surgeons, physical therapists, and real-life results. Because the truth is, walking is not enough anymore. Doctors now say seniors must do one specific movement that protects something far more important than muscles. Right arrow your independence. Most people don't know this, but the number one reason seniors end up losing their mobility isn't heart disease. It's not arthritis. It's not diabetes. It's something much simpler, yet far more devastating: a fall. A single fall can change your entire life. And according to top orthopedic surgeons, walking alone does nothing to prevent that risk. But one exercise does. One exercise strengthens the exact muscles that stop dangerous falls, improves balance, supports aging joints, and rebuilds strength even if you haven't exercised in years. And that exercise is shockingly simple. Today, you'll learn what that exercise is, why surgeons call it better than walking, how it protects your mobility, how seniors over 55 can start safely, and how just a few minutes a day can change your future. Stay with me. Because seniors who watch until the end usually say, "I wish someone told me this 10 years earlier." Section 1. The hidden decline after 55. Nobody talks about this. Let's be brutally honest. Most seniors don't notice their strength slipping away until it suddenly matters. After age 55, your body naturally loses up to 1% of muscle every year. Balance, reflexes, coordination, fast twitch muscle fibers, joint stability, lower body power. This decline is slow, quiet, and often invisible. You may feel fine walking, but notice. Standing from a low chair feels harder, knees feel weak when getting up, you hold onto furniture more often, getting out of bed feels heavier, you hesitate before climbing stairs. These are early signs your mobility is fading. Walking won't fix this, because walking never trains the muscles responsible for standing, balancing, and transitioning between movements. Surgeons say, seniors don't fall while walking, they fall while moving from one position to another. And that's where this one exercise becomes essential. Section 2, the exercise surgeons prefer. Sit to stand. Alright, here it is. The exercise proven to build strength, balance, and independence better than walking. Right arrow sit to stand, also known as the chair rise exercise. Do not underestimate this movement. Sit to stand is used in surgical recovery programs, physical therapy clinics, senior rehabilitation, balance training, fall prevention programs. Why? Because sit to stand strengthens the exact muscles that keep you steady, stable, and safe. Glutes, quadriceps, hamstrings, core, lower back, hip stabilizers. These are the anti-fall muscles. Walking barely touches them. Sit to stand improves. Checkmark balance, checkmark stability, checkmark joint protection, checkmark core strength, checkmark leg power, checkmark coordination, checkmark confidence in daily movement, and it trains your body for the single most important skill for aging adults: standing up without struggle. That's not just an exercise, that's independence. Section 3, the emotional reality seniors feel but rarely say. Let's talk about something deeper. Most seniors don't fear aging itself, they fear losing control. Losing the ability to stand up easily, get out of bed, climb stairs, move without depending on someone, feel steady walking, maintain confidence. These small daily struggles slowly chip away at independence. And many seniors silently worry, what if I become a burden? Sit to stand directly targets that fear, not by promising miracles, but by rebuilding the strength aging slowly takes away. It's more than a physical exercise, it's a message to your body. I'm not done yet. Section 4, how to do sit to stand correctly, surgeon approved form. This is where most seniors go wrong. Doing the movement incorrectly can strain your knees and back. Here's the safe, step-by-step version. 1. Choose the right chair. Use a firm, stable chair, not a couch, a soft padded chair, a rolling chair. The seat should be around knee height. 2. Proper starting position. Sit near the front edge, feet flat, hip width apart, knees slightly bent, hands on thighs, not pushing hard. This position activates your leg muscles from the start. 3. Lean forward slightly, bring your chest slightly toward your knees. This shifts your weight safely, reducing back and knee pressure. 4. Push through your heels, stand up slowly, using the power from your legs, not your arms. Focus on check mark, keeping your back straight, check mark, keeping knees in line, check mark, engaging your core. Count 1, 2, as you rise. 5. Sit down with control, don't fall back into the chair. Lower yourself slowly, keeping muscles engaged until you gently touch the seat. This slow descent is where most strength is built. Section 5, how many should you do? Age 55 to 85 friendly. Here's a simple guide you can adapt to your level. Beginner, low mobility, 5 repetitions, 1 to 2 sets, 3 days per week. Use arms lightly if needed. Intermediate, 8 to 12 repetitions, 2 to 3 sets, 4 days per week. Hands off the chair. Advanced, good mobility, 12 to 15 repetitions, 3 sets, 4 to 5 days per week. Slow descent for extra strength. This exercise becomes easier shockingly fast. Most seniors improve within 2 to 3 weeks. Section 6. Why sit to stand works better than walking. Here are the surgeon-backed reasons. 1. Trains fast reaction muscles. These fibers help catch yourself if you trip. Walking does not train them. 2. Strengthens major leg muscles. Your biggest stabilizers, glutes and quads, activate fully during sit to stand. 3. Rebuilds balance reflexes. Standing up and sitting down forces your brain, muscles, and nerves to coordinate. This reduces fall risk dramatically. 4. Improves real-life mobility. Walking is a straight-line movement. Sit to stand improves getting up from bed, getting off the toilet, standing from a couch, climbing stairs, bending down, transitioning movements. These are exactly where seniors fall. 5. Boosts heart and amp lung function without long walks. Just 10 repetitions raise heart rate, circulation, lung capacity. It's safe cardio without the joint stress. Section 7. A 2-minute story that keeps seniors watching. Stories stick. Here's one crafted for emotional engagement and retention. Meet Ellen, age 69. Ellen used to walk every morning. She thought that meant she was healthy enough. Then one day, she tried standing from her garden chair, and couldn't. Her legs felt weak. Her balance felt unsteady. She felt embarrassed, and scared. A physical therapist introduced her to sit to stand. He said, "This exercise will give you your legs back." She started with just 5 repetitions a day. Within 3 weeks, she stood up easier, her knees hurt less, her balance improved, she walked more confidently, her energy increased. Today, she says, "Walking helps my heart. But sit to stand gave me my life back." Imagine this for a moment. You walk into your doctor's office, expecting the usual checklist. Are you walking daily? How's your blood pressure? Are you eating well? But instead, your doctor pauses, looks directly at you, and asks, "Are you doing resistance training? Not yoga. Not stretching. Not even cardio. Resistance training." Because for people over 55 who want to stay active, mobile, and independent, it's not a nice to have. It's the difference between aging fast and aging strong. And here's the shocking part. Most seniors who think they are too old for strength exercises are the ones who benefit the most from it. Your muscles are not gone. Your strength is not finished. Your body is not too old. You simply haven't woken up those dormant muscle fibers yet. And the moment you do, everything starts changing. Let's break down what happens inside your body when you start the sit to stand strength method consistently. 1. Your joints get happier. Instantly walking is great for joints, sure, but it's still repetitive movement. Same motion, same pressure, every day. The sit to stand exercise is different because it strengthens the muscles that protect the joints: quadriceps, front thighs, hamstrings, back thighs, glutes, hip muscles, core, balance and stability. When these muscles get stronger, your knees and hips feel lighter, more supported, and less stressed. That's why orthopedic surgeons recommend this one exercise to patients even after surgery, because it strengthens without overloading. Strong muscles equals healthy joints. It's truly that simple. 2. Your balance improves without even trying. Most people assume they fall because they've lost balance, but that's only half true. The real issue? Weak stabilizer muscles that can't react fast enough. Sit to stand fixes that by training your body to stabilize during movement, teaching your brain to fire the right muscles at the right time, improving reaction speed, strengthening your core, enhancing hip stability. Balance isn't built on a balance board. It's built by training muscles that keep you upright. Do this exercise for 2 to 3 weeks and you'll notice. Checkmark less wobbling, checkmark more confidence walking outdoors, checkmark easier time getting out of bed or chairs, checkmark better posture. This is why geriatric physical therapists call this exercise a fall prevention superpower. 3. You build muscle even if you haven't exercised in years. Here's something most seniors don't know. When you hit age 55 plus, your body becomes extremely responsive to strength training. Not less responsive, more. Why? Because your body is craving movement that signals, we need to rebuild muscle. Even small strength exercises trigger powerful responses. Improved protein uptake, increased muscle fiber activation, faster muscle rebuilding, stronger neuromuscular connections. Your body hasn't forgotten how to build muscle. It was simply waiting for the signal. And this one exercise delivers that signal without equipment, gym memberships, or complex routines. 4. Your heart works more efficiently. Without high-impact stress, most seniors assume cardio is the only way to strengthen the heart. But here's what cardiologists know. Strength training increases heart health through a different pathway. When your muscles grow stronger, your blood vessels become more efficient, your heart pumps with less effort, your blood pressure stabilizes, circulation improves, glucose is used more effectively. In fact, studies show resistance training can reduce the risk of heart failure just as much as walking or cycling, and sometimes more. So even though the sit to stand looks simple, your heart is doing meaningful work in every representative. 5. You burn more calories. Even while sleeping, walking burns calories while you walk. Strength training burns calories all day long. Why? Because muscle is metabolically active. Meaning, the more muscle you build, the more fat you burn, automatically. Seniors who start resistance training often notice looser clothes, better energy, less belly fat, improved digestion, reduced inflammation. This single exercise quietly resets your metabolism without forcing you to do long workouts or extreme dieting. 6. You reverse biological aging. At the cellular level, this is the part that always shocks people. When you perform strength-based exercises, your body increases levels of growth hormone, testosterone. Yes, even in women, IGF-1, mitochondrial density. These are the exact markers researchers use to measure youth inside the body. In plain language, strength training makes your cells behave younger. You're not just feeling stronger, you're literally aging slower. This is why doctors, physiotherapists, and longevity researchers keep repeating one sentence: strength is life. How to do the surgeon-approved sit-to-stand routine safely. Let's make this incredibly simple. You don't need to overthink anything. You don't need special equipment. You don't need perfect form. Just follow these steps. Step 1. choose your chair. Pick a stable chair with no wheels and a firm seat. Feet should be flat on the floor. Step 2, cross your arms or keep them forward. If you're advanced, cross your arms. If you're a beginner, hold them out in front. Step 3, stand up slowly, lean forward slightly. Push through your heels. Stand tall. Step 4, sit back down gently, control your movement. Avoid dropping into the chair. Step 5, repeat for 1 minute. That's it. Just 1 minute. If you start today, in 30 days, you will not be the same person physically or mentally. A senior's real experience, and how fast life can change. Let me tell you about Mary. She's 67. Lives in Florida. And her biggest fear wasn't aging, it was becoming a burden. She walked every day. She tried stretching. She tried senior yoga, but she felt her legs getting weaker with time. Her doctor told her, walking is good, but resistance training will change your life. So she did this one sit-to-stand exercise. At first she could only do 5 reps, it felt impossible. 2 weeks later, she was doing 15. A month later, she could stand without using her arms at all. She told me something powerful. I feel like I'm aging in reverse. Her confidence came back. Her posture improved. Her knee pain reduced. Her balance became steady. She no longer feared falling. And it all started with a chair. Just a chair. And the decision to begin. Why you can't wait another year. Every year after age 55, the body loses up to 1% muscle mass, 2 to 3% strength, 1% bone density. But seniors who start resistance training, they gain muscle. They gain strength. They gain energy. Age doesn't take your strength. Inactivity does. This exercise gives it back. Before you go, I want you to remember something important. Staying strong after 55 isn't about looking younger, it's about keeping your independence, your confidence, and your freedom. If today's video helped you understand the one exercise that can truly change your life, please hit the like button. It tells YouTube to show this to more seniors who need it. And if you want more surgeon-approved tips to stay mobile, energetic, and healthy, make sure you subscribe and turn on notifications. Because every week, we bring you simple, life-changing routines that help you age stronger, not slower. And now my question to you is, how many sit-to-stands will you do today? Let me know in the comments. I read every single one. Stay strong. Stay active. And I'll see you in the next video.